Hi, my name is Bill. I had a right knee, supposedly bone on bone. I was dealing with this pain in the right knee for approximately a year to a year and a half time frame. My left knee replaced. Having gone through what I did with my left knee for 5 years, I said I'm not going to go 5 years again with that kind of pain. And so I started investigating the whole stem cell, therapy. And I came upon Infinite Medical Group mostly because they were relatively near me. When I first started looking, you had to go to Panama or Tijuana, and I said, well, I'm not going to do that. So I saw that they were about 45 minutes to an hour away. I said, that's much better. I ended up talking with Angela, Dr. Angela, about this, and I grilled her pretty good. I asked a lot of questions, very skeptical, because it just seems like once your cartilage is gone, it's gone. Well, when the doctor went in, before she did the injection itself, she had a little ultrasound thing, and she showed. I said, "Look," she goes, "Oh, you have a bit of a gap." I said, "Can I see?" She had an iPad. She turned it around, and you can't see the cartilage, but you can say you're not completely bone on bone. There is a gap, as small as it may be. There is a gap, and there is some, let's call it, material there. So, and apparently that's all that it needs. You need just a little whisper of life, and then it can make it come back again. So anyway, we had a very long discussion and made an appointment. And it was a two-step process in which they did exosomes, which is basically to reduce or get rid of systemic inflammation, which was amazing in and of itself. Which then I started to feel a little more comfortable with the process, like, well, maybe this will work. And then went back approximately 2.5, 3 weeks later to get the actual stem cell injection, which was actually a week ago yesterday. And in both instances, well, in the case of the exosomes, within 4 hours, my inflammation was gone. Not reduced, it was gone. And which to me was, I've been swallowing Advil like candy, and this Advil doesn't hold a candle to these exosomes. So I was very hopeful that the stem cells would have a similar result, which it seems, this is very early on because it takes 90 days for the stem cells to really take effect. But even with that, prior to the first visit, I couldn't walk 5 houses down the street. 5 houses. And I had to stop, recover because the pain was so great, and then hobble back home. 2 days after the stem cell injection, I walked around the block with no pain. That to me is amazing. And I did it again yesterday. Matter of fact, I went a little further. It's really amazing to me. And I'm the first to say I was a skeptic. I was hopeful, but I was a skeptic. And the people at Infinite helped me through my skepticism because they've heard it all before. When I first got there to do the exosome, it was just an IV drip. A saline solution when they injected the exosomes in there. I recommend that for anybody who's got inflammation of any sort. Amazing stuff. Amazing. I can't believe it. Dr. Lucy, she was really good. Really good. And she is a real MD from Johns Hopkins. Well, what I like about stem cells is it treats the root cause. As opposed to most other things, it treats you symptomatically. And it doesn't deal with the root cause. And with my left knee for about 5 years, swallowing anywhere from 2 to 4 Advil a day, all it did was get me through a day. And you wake up with the same pain, the same stiffness all day long. You're just trying to mask the root problem, never dealing with it. So I said, there's got to be a better way. We got to identify what's causing. Well, we know what causes the issue, but nobody was really talking about how to deal with that root cause short of knee replacement. From the front desk right to the nurses and Dr. Lucy, everybody was just incredible. Marissa, who was my nurse who did the exosome, she spent a ton of time with me, maybe more so than she needed, but she was very patient, very interested in how things went. She called me a week and a half after. How you doing? What's going on? Talk to me. In fact, I called in earlier this week and talked with Jamie, and she says, do you mind if I put you on speaker? Marissa is here standing next to me. She goes, she really wants to hear all this. So I repeated myself, and she was, you could just tell, they're your biggest cheerleader. They want to see you better. Don't wait. I mean, do your due diligence. Ask your questions. Don't go in blind because I or anybody else says so. Answer your question. If someone is in some sort of pain, knee, whatever it may be, do your due diligence, but make the call. It's definitely worth it. Yeah, I'd just like to thank Jamie and Dr. Lucy, Infinite Medical Group, and they're great. They're the best. Go see them.